put myself on mute.
And then we'll just go ahead and
look at those numbers grow.
Yeah.
Can people hear us right now?
I believe so.
So we shouldn't gossip or, okay.
Well, we can. It's also being recorded too. So that's
Jonathan
good.
saying he can hear us. Go right ahead.
Yes. Good. So we're just going to let people sign in and get started in another 2 minutes.
Nope.
I see all you Woods Hole people, and I'm trying to represent with my Woods Hole chart here in the background.
So just got asked if we will see all participants or if a list will be shared. I'll talk about that in the housekeeping, but we won't be able to see all the participants. This will be done as a webinar as opposed to a Zoom meeting. So you get us, you get the 4 of us. Okay, I am going to go ahead and get us started here. Welcome, everyone. Appreciate very much everybody showing up for our webinar, our second in what we think might be a series of webinars and educational events for our community. So thanks very much for everyone for participating. First of all, I want to introduce myself. I'm Chris Von Wald. I'm the Executive Director of Tall Ships America. And I want to kick this off with just a few housekeeping items. First of all, as always, bear with us with the technology. We hope that it works, but it's all still very new to us. So, we'll make sure we do the best we can. Let us know if you have any issues. If you want to say hi to anyone, if you want to share a resource, if you want to just offer a random comment, we would love to hear from you. And you can put that in the chat box. If you have a question for one of the panelists, if you could please put that in the Q&A, and then that will be the thing that we monitor, and we'll go through questions at the end of all 3 of the presentations. We will be sharing the recording of the webinar and the slides from the webinar, so those will be uploaded onto our website later this afternoon. So you can make sure you have them and share them with anyone and everyone who you think might be interested in what we're talking about or who wasn't able to attend. We're also going to be sending out a feedback survey. It should come out automatically tomorrow. Please do take 2 minutes, and I promise it's only going to take 2 minutes, but we would like to hear from you and also hear if there's other topics you'd like for us to cover in any of the webinars. So please respond to that survey. Finally, we do have about 100 people registered for this, and we aren't going to be sharing a list of those who are attending. And that, you know, some people do attend or share full lists of attendees, but we're not going to be doing that. And if it is something that people are really interested in, then we'll make sure that we offer it later. But just want to respect people's privacy for being able to attend in this fashion at the moment. So I want to just offer just a little bit about why we're doing this particular webinar. Obviously, this is an uncertain time and everybody has to think about things from a risk perspective and making decisions about safe programming and sail training operations. And we don't have a playbook, we don't have a guidebook for this. And we're looking around at others who are operating with guidebooks and have possibly some more concrete ways of approaching a return to opening, but we don't have that. And so we're gathering our community together and having a conversation about that. Tall Ships America has a Ship Operations Safety Committee, and they're responsible. They help us gather information and keep an eye on any issues of safety and sail training. And so we've been having conversations about this pandemic and all of the questions that it's raising about safe practices in light of the virus. This session, we're going to do our best to present some things to consider, some questions to ask when making decisions about when and how to sail, with whom, and what the impacts are for crew and passengers. And I want to point out that we may not have a lot of concrete answers to those questions, but it's important that we ask these questions together so we can do our best to come up with the best answers. We also, in this particular session, we're focusing on longer term voyages and overnight kinds of events. And we're not necessarily going to address the issues specific to day sails. And that is something we want to return to. And we will offer a session about day sails in the future. So today we have 3 panelists joining us. First of all, we have Bill Frederick. He's joining us. He's the founder of Lodestone Safety International, and he's going to offer his perspective from a wealth of experience, providing consulting services, specializing in health, safety, and security for educational organizations operating abroad. Previously, Bill has been the position of Director of Safety at the School for Field Studies for 8 years, and he served with Outward Bound for 16 years. He was the chair of the Forum for Education Abroad's Pilot Incident Database and served for 3 years as co-chair for the Forum Standards Institute Beyond the Basics of Health, Safety, and Security. Bill's taught wilderness emergency medicine for over 30 years, and he has been a faculty committee member for the Wilderness Medical Associates International, and he developed travel medicine curriculums there. Bill has led numerous international safety reviews and has provided risk management training and program development for over 150 educational and service institutions in over 30 countries. We are honored and privileged to have Bill come here and speak with us about the topics that he has such experience in. We're also going to be joined by 2 well-known members of our own community, Shannon McKenzie of Mystic Seaport and Jen Haddock of Sea Education Association. And both of them are going to share their perspectives and experiences around risk and operations in this environment. Shannon's the co-chair of the Tall Ships America Conference Committee and is a member of the Ship Operations Safety Committee. And her day job is as Director of Watercraft Programs at Mystic Seaport. She oversees the programs of all of the museum's operational vessels, including the 1932 schooner Brilliant. Jen serves on the board of Tall Ships America, is a member of the Ship Operations and Safety Committee, and is a port captain at SEA in Woods Hole, Massachusetts. She oversees the ship logistics, maintenance, crew, training, and hiring for Corwith Kramer and Robert C. Seaman's tall ships, as well as sales. She sails as mate and captain. So we're going to hear from our panelists and then answer as many questions as we can. And so with that, I'd like to go ahead and turn it over to Bill Frederick to get things started. So Bill, thank you for joining us.
Thanks very much, Chris. Good afternoon and welcome, everybody. As Chris said, what I usually do, what my company usually does, is health, safety, security for educational and service groups working overseas, mostly safety reviews, tabletops, staff training, etc. I am also on the Safety Advisory Committee and boards of a couple of adventure education organizations, and Tall Ships America invited me in to be part of their deliberations as we're all looking at what it's going to mean to return to operations in a pandemic world. And up until 3 weeks ago, all the conversations across very different organizations were very similar. Everybody would sit down, talk about what we think we knew, what we thought we didn't know, what made sense to move forward, and we would start trying to implement what the risk reduction protocols would look like on particular programs, and looking at some of the more common things, social distancing and masks, and trying to figure out what actually would work and what wouldn't work. And as we were trying to plug all those things in, at some point the realization would settle in on everybody that no matter how good we were at implementing the risk reduction protocols, we really could not reduce the risk of a participant getting COVID-19 in the presence of somebody that was shedding virus, whether they were symptomatic, pre-symptomatic, or asymptomatic. And then usually the conversation would start going into institutional survival and mothballing the program and, you know, getting PPP loans. And but a couple of weeks ago, the conversation started getting a little bit more interesting. And that was kind of based on the realization of these 4 facts. First of all, COVID-19 is likely to be with us for a year, 2 years, maybe forever. Even though Wall Street gets very hot and sweaty every time another vaccine candidate makes it to the next trial, the shortest period in which a vaccine has ever been created is about 4 years, which was for mumps. And there's a lot of viruses that people have been working on the vaccines for a long time without any success. HIV has been with us for 30 years. Dengue fever has been with us for 87 years, and there are no vaccines, and not for lack of trying. So we may well just need to learn how to live with this, and we'll talk about that a little bit later. Second fact is that there's no set of operational risk reduction practices, as I said, that at least yet, that confidently eliminates the risk of getting COVID-19 in the presence of a carrier. Outside of isolation and quarantine, we've had fails of all the safety protocols in grocery stores and medical facilities, et cetera. And then the third fact is that potential participants who have been reading, seeing, hearing the same news we've all been hearing, reading, and seeing, who understand the risks, want to participate in programs. And programs would like people to participate in programs. And if everybody understands and accepts the risk, then perhaps we can start looking to figure out, you know, what do we need to do to operate. One of the things that I would caution everybody against is the emotional expression that the comment on the top of this, that a board member several weeks ago expressed that it feels like we're coming out the other side of this event. And I was at the beach near my house this morning. There are a lot of people that obviously are feeling like we're coming out of this. They were not particularly far apart. They weren't necessarily wearing masks. With all the talk about concern for future waves, with all the talk about opening up, there is this emotional sense that we've come through the first part of that. And When you look at the data, however, the reality is a little bit more like the quote from below from Tom Inglesbury at Johns Hopkins, that we're in the middle of a global trial and error period. And if you're one of the early starters, you're going to operate in this summer or this fall, then you should really be looking at it as an experiment, and you should make sure that all of your stakeholders are looking at it as an experiment. And the key to doing this is going to be excellent communications, clarity, total transparency, and sharing the risk, and understanding that we're sharing the risk. And this is very different than how we've operated before. For the most part, when we've had risks, we get them down to to where we think we have pretty good handle on it and control over it. And this is going to be different. We don't ask our participants to share the risk like we're going to be asking them to share the risk in this instance. So one of the things that has made the whole pandemic a little bit more difficult than perhaps it needed to be was the fact that there's no unified authoritative voice speaking either internationally or nationally on what is or what isn't. The people that you might have thought, or the organizations that we might have looked to for guidance on this, the WHO internationally, they may or may not have made some mistakes early on, but they have been undermined in a number of instances, and now they're just one of many voices. The CDC did make some mistakes here, and other authoritative figures have been spreading conspiracy theories and quack medicine, et cetera. And so there's a lot of different voices out there, and there's also been a tendency to push responsibility down from the federal government to the state government, to counties and counties to participants. And so it's a little difficult to, you can't just look at an authority and say, do what they say to do, and then we should be okay. It's more complicated than that. But at the same time, there has been a very, very steady, plotting, systematic gathering of data and research and the uncovering of facts. And this has been happening for 2.5 months as we learn more and more about this, which is going to help us function more effectively in all this. When the outbreak first took place and was going on in China, we were hearing that it was not spread person to person. And then we were hearing, yes, it is spreading person to person, and a little bit longer incubation period than a flu virus. And then we found out that pre-symptomatic and asymptomatic people were shedding virus. And we were hearing that older people and people with pre-existing conditions were much more vulnerable. And that, as a matter of fact, if you're under 20 years old, you had a 56%, as the bullet point says, 56% less likelihood of catching COVID-19. And then we started hearing just a couple of weeks ago about the multi-system inflammatory syndrome. And so now we're back to worrying about everybody. We're hearing about ethnic minorities and migrants who are more susceptible for historical and sociological reasons, and all the economic implications of COVID-19. There are some facts that we learned which were really important for a while and then became less important. We were hearing that the disease was only spread by coughing and sneezing, and now we're hearing that it's spread by talking and singing. At one point, my family, when we'd go to the grocery store, we were wiping down every grocery item with a Clorox wipe, because we were hearing about the virus remaining viable on cardboard and hard surfaces over a prolonged period of time. And then last week, the CDC came out and said that the virus is not easily transmitted via surface touch. But then this morning, the Journal of Science just came out with another study of a South African hospital that says they think most of the spread in their hospital is because of the virus being on surfaces and not through shared airspace. At any rate, we're learning more and more, and it's helping us figure out how to navigate this. The most important facts of the last week was the primary importance of shared airspace and airflow. And all the cases that you've all heard are these super spreader events. In the upper right-hand corner here is the choir practice story, where the red-colored person infected all of the yellow-colored people singing for a couple of hours in a relatively enclosed space. And then in the lower left is a Japanese restaurant diagram, and you can see the arrows going from right to left. That's the air conditioning that was making the airflow go that way across the tables, and you can see all the circled people are people that got infected, whereas perpendicular to the airflow, those tables E and F did not have any infections. And then the lower right corner is a call center in Korea. This was a 17-story building. The infected person was coming and going for multiple day period of time, pushing elevator keys, walking around. Nobody else on any of the other floors in this building got COVID-19. All of the people that got COVID-19 were on the floor that this person worked on, and usually in the pretty close to the space that they were in. So what that's saying is that, yeah, don't stop washing your hands, don't stop cleaning surfaces, but covering our mouths, making sure that we're not sharing airspace, et cetera, ventilation are some of the more critical aspects of risk reduction here. And then there are the things that we know we don't know. There's been a lot of talk about future waves, and the Center for Infectious Disease Research and Policy out of the University of Minnesota has a great article, and it's attached in your sources that we put together for this webinar. It gives 3 scenarios, and one of those scenarios is the scenario that the WHO just put out a warning for on Monday, which was a very a subsequent serious wave coming on the heels of opening up a little bit too soon. So that scenario would say that we're likely to have another significant wave in the United States by late June, early July. The scenario that a lot of people have talked about is the scenario where a very serious wave comes through in late fall. And the main reason that I can tell for all the concern about this is that simply because that's what happened in 1918. And this virus is very different from the flu virus of 1918. World War I's not going on. The travel is a little bit different. And so I'm not sure that there's a lot of data that supports that. And also the coronavirus does not mutate anything like the flu virus does. But the third scenario is probably the most likely, which is that this is just going to pinball around the world back and forth for some time to come. And one of the things that they're realizing, one of the questions was, does illness afford immunity? And so what they're realizing now, or the data that's coming out now, shows that people who were very ill and recovered do have a pretty robust immune response, at least in terms of having the presence of a lot of antibodies. How long those antibodies last? Do they last a month? Do they last a year? Do they last 2 years? Are they lifelong? That research hasn't been figured out yet, but coronaviruses are not known for long-term immunity, or we would never get a cold after we'd had our first few colds. And so if that is the case, if disease doesn't afford long-term immunity, most of the vaccine models that are out there are not likely to create immunity either, which also, if immunity is very short-lived, then herd immunity is not going to happen on its own in a significant way. So all those questions are up in the air. Who knows? But stay tuned, and just don't assume that we're waiting for the vaccine for this to be over. So now getting into operational strategies. Some of you know Deb Hayes. She got in touch with me to say, mention that a lot of programs that do not yet have a medical director should consider getting a medical director for 2 reasons. Number one, adapting standards to your programs. Until somebody comes out with a standard that is really customized to what you do, you're going to be adapting a lot of pieces. And so it would be great to have medical expertise help you figure out what those adaptations look like. And then if those adaptations are not entirely successful and you have a student or a participant get coronavirus, then if you find yourself in court, it would be great to say, we didn't just make this up. We had a medical professional help put this together. We'll talk about some of these operational strategies separately. If we could screen out students effectively, if we could figure out who has virus, who's going to have virus, et cetera, and then just start our programs where nobody is symptomatic, asymptomatic, or pre-symptomatic, we wouldn't be having this discussion because it would be a very easy process. But as it is, until the PCR testing, until the polymerase chain reaction testing that tells us whether somebody is actively shedding virus or has virus in the moment, until that becomes cheap, available, and fast, we're not going to be able to effectively screen students as they participate in our programs. We should still do it. We should still document it. But what you're left with is basically looking for symptoms and history. And the symptoms that most people have been talking about is, do people have a temperature or do they have a dry cough? What a lot of my friends that are working in medical environments right now are saying is that they're seeing a lot more muscle aches, GI, gastrointestinal issues, loss of taste, smell. I haven't heard anybody talk about COVID toe, but that's something that was in the newspapers. And all those symptoms, as people read through those, we all start to think, I'm pretty sure I've had COVID-19, which probably most of us haven't if we haven't known about it, but maybe. When you're looking at students getting on your program, some of the pre-existing conditions that have been problematic for people that got COVID-19 would like high blood pressure and diabetes. You might want to have a conversation with anybody with those kinds of pre-existing conditions before they come on your program. But also you want to know what people's exposure history is. So if you have students coming on your program and they have someone in their household who works in a medical environment who has been going to work every day exposed to COVID-19 patients, then that might be a discussion to have. Serology testing at the moment, it's all the same issues about whether or not having antibodies, how much immunity that affords you. For all the talk about immunity passports, we're not there yet. And serology testing at this point is not necessarily very accurate. So risk reduction protocols. It seems like depending on where you are in terms of the duration of your programs kind of dictates what makes the most sense. If you're on a very short duration program where you really have very little control or understanding of the likelihood of whether or not you have anybody that could be carrying COVID-19, then it's all the things that we're hearing about in the CDC or what you do when you go to the grocery store. It's social distancing, it's daily screening, it's lowering the capacity so that you have fewer people in an enclosed space. It's about face coverings, and we should talk about masks versus face coverings. Masks, as in N95 masks, they protect the wearer. They filter out 95% of particulate matter, and that is, they're in short supply, so we're asked not to use those so that they are reserved for people who are working in high-risk areas, mostly hospitals and clinics, etc. Surgical masks and face coverings are essentially covering our mouths and nose to protect other people from us. They are not intended to protect us from other people. But given what we've learned about the spread of COVID-19, it certainly makes sense. If you can't do pretty good social distancing, having masks on is critical. And then, of course, the cleaning procedures for high-touch surfaces, food management. You don't want to have buffets. You don't want to do anything family style. If you're serving food, you want each individual participant to have a plate of food. And a lot of what people are working with is trying to figure out smaller cohorts. So if you were on a boat that was doing, that had different watches, you would try to keep the watches from having any overlap so that there's no cross-contamination between those smaller cohorts. If you were on a day sailing program and you had 2 or 3 people in a boat, you'd want to have the same 2 or 3 people in the boat every day so that they're not being exposed to other people, etc. On longer programs, the strategies that I've been hearing about have been had a lot to do with doing a quarantine period, either at the beginning of the program or prior to the program, so that if anybody was pre-symptomatic, you would catch that. You would catch anybody that was going to start having symptoms. You still would not catch somebody who was going to be asymptomatic. And if somebody is going to be asymptomatic, they could be shedding virus well after the 14-day period. But the PCR testing is available in some states. And if you could do some combination of quarantine and testing, you might reliably, with pretty good reason to have confidence, if you had a boat full of people who you are pretty sure do not have virus, then they become their own quarantine bubble. And then after that, all you have to make sure is that you don't introduce any contamination into that bubble. So minding the boundaries there. And below are some of the creative social distancing techniques that some people have been using in different places. You need to create contingency plans, and you should game these out from beginning to end to see, do you really have all these pieces in place? Understand that if you have a student start to manifest symptoms, calling for help and saying, come evacuate them, an insurance company that, or an evacuation policy probably would not be engaged by the fact that you have a student with symptoms unless they were life-threatening symptoms. So most states are instructing people who show symptoms to isolate or quarantine at home. And as a program, that might be what you need to be able to figure out how to do. So do you have isolation and quarantine capacity? Do you have evacuation capabilities? And if you're operating overseas, are you in places where you might not be allowed to put in to evacuate somebody off the boat? One of the conversations I was having in Maine with the program a couple of weeks ago, there were a couple of doctors on the call, and they were pointing out that depending where you are in Maine, local facilities don't have a lot of capabilities for COVID-19 patients, and they would not welcome you showing up and saying, yes, we've got some very sick people here, please come get them. And then we'll talk about crisis communications plans, but you should be thinking also, should you have a crew member or a student come down with COVID-19, what do you do next? What's your communications tree? When do you call the family? When do you call the family of every other person on there if they're minors? Go through your whole communications tree for that and figure out, is the trip over? Is the trip postponed? Are you carrying on? What's your plan? And you need to communicate that plan to your constituents before you take off. As I said earlier, communications is going to be perhaps the most important part of this. Clarity and transparency are absolutely critical. I've read on a couple of websites for some of the early starters that are planning on going, they described the risk reduction protocols that they're planning on instituting. And then they say, these are the great things that we're doing to ensure your safety. If they had somebody have a bad outcome, get sick with COVID-19 and have a permanent disability or have a fatality from that, if I was a plaintiff's lawyer, that phrase right there would be all I needed to say, that you promised to keep them safe. So don't sell safety. Make sure that everybody's understanding the risk, and I'll come back to that when we talk about legal issues. Crisis communications plan, what are your inward facing plans? How you contact everybody in your organization? How are you going to interface with the media? This is a hot topic. The media will be interested. You have talking points that you feel confident in getting up and presenting to the world, and are your spokespersons ready to do that? Because the gotcha journalists will be at the dock waiting for you when you pull in with a mask on. A couple of people have been very, in all of the bad communication that we've seen worldwide, the two people at the bottom of the screen there are the two that have done an outstanding job, the Prime Minister of New Zealand and of Germany. And what's been great about their communication is that they didn't sugarcoat anything. They did not reassure everybody that it was all going to be okay. They were very, very factual, and they were very much about figuring people can handle difficult things, and they put it out there in very plain language. And everybody in their countries is very grateful for that. And that could be a model for your communications plan. So legal considerations, this is uncharted territory. I talked to a whole bunch of lawyers about what does it make sense here, and what's our duty of care, and is this a foreseeable risk, and all that stuff. There's, as you can see from the bottom here, this is a slide from a couple of weeks ago. There were 771 lawsuits out there, mostly for hospitals, meatpacking plants, and grocery stores, where people got infected while they were working. I work a lot in study abroad, and during the not tremendously smooth suspension of programs all over the world, a lot of students got stranded overseas, and a lot of students got COVID-19. And I've been fishing around to see if anybody has heard of any lawsuit, but it may either just be too soon, or that it may also be the case that all the students, or most of the students that had COVID-19 just got better, and there's no harm. But I am not aware of any lawsuits having to do with programs yet, but that may eventually be the case. So what everybody says, what all the lawyers I spoke to said, is that you really do need to comply with whatever authorities apply to you. And if you have multiple authorities applying to you, so if you have state requirements, and you also have, if you're certified as a camp, you have the ACA requirements, you should adhere to whichever one is the strictest to the degree that you can. And you want to be able to refer to a standard to say that you didn't just make this up, even though as you look at the CDC protocols, or they are presented more as suggestions than as a course of action that you should take. So understand that none of the authorities that you apply to your programs are authorities that you can say, we did this, so we're okay. But you want to at least be able to say, you know, we met the, we did due diligence, and we met the letter of the law. And talking in terms of informing patients, what two lawyers said to me very clearly was, this is not just about inserting a little bit of extra language in your waivers or participant agreements or releases to say also COVID-19 along with all the other hazards there. They said what they recommended was that you use an informed consent type document, or you create a document that makes it really, really clear that this is different than all the other risks that you manage in a program, and that you are not purporting to say that you're ensuring their safety. What you're saying is that you are going to take these steps and be very clear about what those steps are, and then say, and, you know, we're going to do our best to reduce the risk, but we, you know, there's only so much we can do. And there is very much a risk of getting COVID-19 if somebody on this boat has COVID-19. And so an informed consent is really kind of the kind of document you sign when you're going into heart surgery, just saying you really do understand the consequences of this. And I don't think most people are put off by this, but if you're going to operate, this is what's recommended to do, okay? Insurance considerations. A lot of people were, insurers are going to be one of your constituents that you're going to be renegotiating your relationship. For those organizations that are just trying to survive right now financially, which might be a lot of you out there, you might want to try and negotiate not paying a premium for policies that you don't need right now to cover programs you're not running. If you've already renewed your insurance for this year. Our insurer has let us drop some policies temporarily, so we can save a few bucks. An insurer who is insuring at a study abroad outfit, they're negotiating terms from the point of view of when to say that something is a pandemic or to say that something is an emergency sometimes depends on the US Embassy or the country that you're operating in. They're clarifying with their insurer so that they both agree on which agency makes what call, which will trigger which policy. And getting a lot of clarity on that will help you avoid some of the problems that study abroad programs had this last year when they went to their evacuation repatriation policyholders and said, yep, it's a pandemic, evacuate us. And the policyholders said, oh, pandemics are excluded. We can help you evacuate, but we're not, we'll charge you for the service, which was shocking for a lot of groups. You should make sure that you do understand, health insurance is not excluding COVID-19, but unless somebody is really, really sick, they're not going to take extraordinary measures to resolve the situation. If somebody's very sick and they go to the hospital, health insurance policies, if they have a high enough limits, will certainly cover that. The major concern I have about insurance is liability insurance. And a few weeks ago, I spoke to an insurance company and they told me that yes, nobody is creating exclusions in their liability policies. A week later, I talked to a lawyer who has seen that in several of her clients, particularly in spring renewals, that insurance companies are inserting an exclusion that was not there before for communicable disease. And certainly you don't want to be operating unless, if that's an exclusion in your liability policy, because in terms of the health of your organization, getting sued for somebody getting sick on your program is one of the biggest concerns. So, and then lastly, it may not exist ever again, but part of the shared risk is to make sure that your participants know if they're flying in and they're racking up some expenses before they get to the boat, you want to make sure that they have trip insurance, trip cancellation insurance for any reason. All that disappeared in April. It may come back, but you would like, some of you may have been spending part of your April with people trying to get your organization to pay for expenses that they incurred. And you want to make sure that that's very clear with people. We're going to be renegotiating our relationship with most of our stakeholders. We're going to be renegotiating our relationship with our students, with vendors, with insurance company, with sending schools, and your contracts or participant agreements or contracts, whatever you have written down, is the formalization of that renegotiation. You want to be really, really clear about everybody sharing the risk. You want everybody, for those of you who spent April having some parties try to claw back money from you while you were trying to claw back money from other people, people's refund policies are going to get very, very, very explicit in terms of percentages, timeframes, cause for the program cancellation, et cetera. People are going to get very, very good at that. And it's really not a matter of putting in really strong boilerplate language. It's just a matter of being really, really clear, using good communication, making sure everybody agrees on it, and just formalizing it. And going back to the trip cancellation insurance, you want to clarify that you're not responsible for expenses incurred by participants before they got to the program. To wrap up my end of this, COVID-19 has been by far the most disruptive event of this past year, but it wasn't the only disruptive event that went on. Worldwide protests, tropical cyclones, wildfires, disease outbreaks. None of those are unheard of events, but the magnitude of a lot of those events this past year was greater than any that we've seen before. And I think looking to the future, we should expect, with global warming going on, with the political situation the way it is, we should anticipate that there will be more disruptive events going forward. And the organizations that are going to successfully navigate this new world, whether it's pandemic world or post-pandemic world, are going to be those organizations that can innovate and adapt and be resilient. And that may sound daunting and it may sound intimidating, but every organization that I've been a part of for the last 30 years has been very actively adapting and innovating throughout that time. We've been adapting and innovating to all of the evolution of communication and information technology, and to an ever-rising standard for health, safety, security. And this doesn't represent a change of what we're doing so much as it does is represent a little bit of a steepening of the curve. So good luck in all of your decision making and your future programs. It's for me personally and for everybody I've been working with, March was incredibly disorienting. April was depressing. And May has been actually very hopeful and a whole lot more interesting as people start problem solving. So good luck with your problem solving.
Thank you very much, Bill. We'll come back to some questions, but first of all, want to see what this looks like in the specific SAIL training world. So first of all, we'll hear from Shannon and then from Jen. So Shannon, you wanna, or is it Jen and then Shannon? Whichever one. One of you jump in.
So at Mystic Seaport Museum, we operate the Schooner Brilliant, and she does a spring racing series for adults, and then in the summer she does 5 and 10 day trips for teens, and in the fall does adult programming. So we, during the, when this all started to happen, we had hauled the boat out in yard the day before basically the world shut down. So we quickly decided to abbreviate her yard period and get the boat back to Mystic Seaport. So unfortunately, they had already started sanding the topside. So we got a coat of paint on the boat and brought her home and covered her and tried to just stabilize the vessel for a little bit while we figured out what was going to happen. Unfortunately, at the time, Mystic Seaport made the decision to lay off the majority of our staff, which included the crew of the vessel. So we had the cover on the boat, and she's alongside the museum at this point. So what we are, just like all of you, we're following along with all of the developments that were coming up and trying to assess the risk for our students. So like I said, Brilliant's a pretty small boat. We have only 9 students aboard, and they're teenagers. So those two things right there were both lower risk in my estimation, that we were healthier, as they were saying at the time, teenagers, and also a small group of people on board the boat. So we had both of those things going for us. So we kept looking forward and had conversations with our health district here in Connecticut, which oversees a lot of our camps and things like that at the museum, conversations with our attorneys, conversations with our insurance company, with our medical director. And so we were just continuing to have all these different talks. Very soon we canceled our spring racing series, but we were still optimistic about our summer teen programming. We had a sold out season in place, and optimistic that we were going to be able to fulfill that obligation. So at that point, the governor canceled summer camps and school up until a certain date. So that date was June 28th, which worked out really well for me, because what I had in June was our 5-day trips. Starting on June 28th, I had 10-day trips going through the next 6 weeks or so. So there I was with 9 students on 3 10-day trips. So it was only 27 students. So again, I felt like this was a lower risk. I started looking at the health forms for the students on board. and there was no interesting or unique health situations on board. Everybody was very healthy. I started to look at their geographical range of where the students were coming from, and this is where I got into the higher risk category, where all of my students for the first 2 trips were from New York City primarily, and New York State, which, as we all know, is a hotspot. So I felt less good about that. We started to figure out how we could operate the vessel in a more safe manner. And one of the things that we considered was the sleeping on board. People were talking about being in a small space and contained for a long period of time. So I was ready to use one of our other vessels as a secondary sleeping vessel, have it anchored out outside of the Mystic River. The boat could sail during the day, come back to the anchorage at night, and have the students sleep on 2 boats to be able to divide them. So we had that in place. The next thing that started happening was quarantining among the states. Rhode Island became very strict with their quarantining. So then I was trying to figure out how I was going to operate only within Connecticut. So because we anchor at night. So I wanted to stay within Connecticut waters. So 10 days in Long Island Sound in July and August. And I was envisioning me going to the grocery store and driving to these different port stops and refurbishing the boat and trying to make the program work. So, you know, we just kept looking at all these different risks and trying to figure out how we can make it work and deciding, all right, well, I think we're okay in this area at this point where we don't feel really good about how can we mitigate that risk. So shortly after this, well, kind of a while after this, all just this timeline is so quickly moving. As the state came out with regulations that said, oh, we didn't mean that residential camps can start on June 28th. We're not sure when they can start. So that was, we didn't know when we were going to get that guidance on when we can start residential camps. So at Mystic Seaport, we also run the Conrad Overnight Camp, which is a state certified camp. Brilliant is not a state certified camp, but, you know, at Mystic Seaport, I do a lot of unique sorts of historic vessels, and I argue always for the spirit of the law when I'm talking with the Coast Guard and other regulatory influencers. And I really felt that the spirit of the law in this case was that really does qualify as a residential camp, and we shouldn't be running the boat. So that, along with the decision that we couldn't run Conrad, meant that we had decided that we agreed we weren't going to operate Brilliant this summer as a teen overnight program. So as Bill was just referring to about, you know, adapting and innovating, we also use Brilliant she participates in a lot of classic yacht racing. And so our current thought is to look for a sponsor for some of these classic yacht races that we could race her in August, bring adults on board. But again, many of those races, all of them take place outside of Connecticut. So it's very dependent on the different states and what they're going to allow for quarantine times coming into these states, whether we can even bring the boat to Maine to participate in these sorts of races. So, you know, right now we're still, boat is still covered. We still do not have crew working on board. We still have not canceled our fall programming, and we're just continuing to monitor the situation and decide whether we're going to go forward with that. I will turn it over to Jen to talk about what SEA is doing for their situation.
Thanks, Shannon. Yeah, our scenario started to play out around March 17th, like many of us. We had both vessels in international waters and with students on board, semester students. One vessel pretty close to finishing the semester, and another had a couple of weeks. With the Corwith Kramer, we were able to pretty much finish out that program as planned in St. Croix and get the students off. Some students got called back early because we work with the universities, and some of their study abroad programs were saying they wanted their students to return to US soil. And that happened also with our vessel, the Robert C. Siemens, who was finishing up a program in the port stop in Wellington, New Zealand. And as Bill mentioned, the Prime Minister of New Zealand was very forthcoming, but also very swift moving in her decisions, which ultimately helped the country, but also made us have to make some decisions pretty quick and also find that some of our resources were limited because New Zealand had shut their door. Luckily, we had enough crew on the ground there to get on the boat, and they were all game and gung-ho to bring the boat back to Hawaii. So they went into, we focused on keeping cohorts and doing the 14-day quarantine time to make sure that vessel, there was no added potential of COVID on board before they started a long offshore voyage. With the Corwith Kramer, she was in St. Croix. We had not as long as a quarantine time, about a week, but knowing that she was coming from St. Croix towards more definitive care if something started to show itself and we had to deal with it. So both vessels, the idea was to get them back to the US, ideally continental US, where we had more options, and continually to work with the whole cohort concept. So currently, Siemens had done a 42-day voyage from New Zealand to Hawaii. And based on restrictions in Hawaii, we're still required to do a 14-day quarantine if they were to remain alongside there. They currently just left after a week of reprovisioning and some rest, and now are headed to the West Coast with pretty much except for a few less crew, pretty much the same cohort that started at the beginning of April. So they're probably one of the most isolated groups on the planet right now. And the Corwith Kramer, we had switched some crew out and did some self-quarantining and pre-questionnaire and also temperature checks. Both vessels have been doing temperature checks of all the crew every day to see if anything develops out of that. We're now, once Siemens gets to the West Coast and the Corwith Kramer here, trying to transition, knowing that, focusing on the crew part of it, how we can switch some of these crew members out to keep the vessels manned to a certain capability to deal with weather that, New England with the hurricane season and things like that. So try to work towards that. And then also in the other part of the organization is focusing a similar concept on how to bring students aboard for our semester programs and how to mesh those two bubbles together on board the vessel. So obviously still an ongoing conversation with a lot of unknowns, but with testing becoming more available, that will certainly play into the equation that we're working towards. Also, we use a great resource, which I think might be, I didn't double check, might be on Bill's list, is UNOLS, which oversees the research vessels, put a great document together on risk assessment in terms of how far offshore, how far away from definitive care, that the guidance in there has helped us come up with some guidelines that we're looking at going forward. And I think that was it on my end.
Well, that's great. Thanks, Shannon and Jen, kind of the view from the trenches. And I know that there are plenty of people who are involved in this webinar who have perspectives from the trenches and the real live decision-making that's going on. I think that in our conversations as the Ship Operations Safety Committee, what we've been talking about is asking a lot of questions and thinking about the considerations. And as you both talk about, kind of going through those live, the kind of if-then scenarios on any one of the different kinds of decisions that you would be having to make along the way. So if you do have a question, we only have one question in the Q&A section and a comment that I want to take from the chat room. But I think, Bill, you had mentioned, and this was part of the conversation that we had with Deb Hayes, but the question is, what type of qualifications would be recommended for hiring a medical director? An RN, a GP, what kind of person would be a good person to fulfill that role?
Well, it would be excellent to have a physician. If you could have a physician if you could have an infectious disease specialist, that would be brilliant. But, especially if you're asking somebody to do this on a volunteer basis and you're not paying them to do it, Certainly having a registered nurse practitioner, a physician's assistant. I mean, somebody that could say, yes, your protocols make sense, and somebody who, when you are asked in court about how you put your protocols together, saying, we accessed real expertise, we didn't just make this up sitting around the table, would be excellent to have. But sure, I mean, having an MD would be your first choice.
Okay. Okay, Jen, this one's for you. Can you talk more about what you were asking of oncoming crew before they joined the ship? Self-quarantine at home, stay on campus for a while? What about their travel considerations?
Yeah, good question, and all questions that we were working through in the Marine Department. So we had them, we looked at many things, all entailed in that question. We had them do a 14-day self-quarantine at home, doing their own temperature and wellness checks each day and documenting that, as well as an exposure question, potential exposure that they might have had before going into that self-quarantining. Looking at when we started bringing crew to the vessel, proximity to the vessel, we didn't, as of a month ago, didn't want any crew traveling public transportation. So they either came in someone's car in their cohort at the time, or we helped rent them a car so they could come. With Kramer being dockside here, we have the added resource of campus. So those coming to join Kramer, we were able to use one of our cottages and have them spend 4 days in the cottage doing laundry. So any of the clothes they traveled with, we had them wash. And also we were doing temperature checks, and if all still was fine after 4 days, they joined the vessel at that point.
Okay, thanks. What about a sample of an informed consent? Are there some things that, you know, should be included in informed consent? Bill, do you have ideas about that?
You know, I would just make sure that, I mean, it's not that there's an element for an informed consent template that you should be thinking about. It's really about making it a big deal and making it really clear, as opposed to just inserting some language that says you won't sue us if you get COVID. You really want to say that here's what we are going to do. This is based on whatever standard, based on whatever, but you should understand that in the presence of COVID-19, if there's somebody who is pre-symptomatic or asymptomatic, none of these things will keep you from getting it, and that you understand that and you are taking the risk. And it's really just making sure that people don't go into the program. I mean, this happens all the time, that we put together excellent participant agreements that spell out risks, and then if somebody does have a bad outcome on any kind of a program, people turn around and say, whoa, I never thought this could happen on the program. And most of the risks that we all manage usually don't happen on programs, but the risk for this is so much higher and so much different than anything else that I know of anybody doing before, that you want to make sure that people really do understand, that nobody is making the assumption that, you know, if I'm a big fan of SEA and I send my child on an SEA program, then I'm not just thinking, well, of course they take care of it. They're wonderful. And if I don't sign this extra thing and then my child gets COVID-19 on their boat, I'm going like, what the heck happened? I want to make sure, you know, that the whole thing about the informed consent is just to make sure that nobody could misunderstand that they are sharing the risk of this, of that whatever the enterprise is.
I have a question. I mean, what we talked about is the difficulty of, like Shannon mentioned, the difficulty of just going across state lines, which is really easy to do here on the Eastern Seaboard. And clearly part of programming for many of our programs. You know, what about international destinations? I know that that's a consideration that many of the programs have. We have had many programs that started internationally before the pandemic and had to kind of come up with plans in the event of the pandemic, as Jen was talking about. What are some of the considerations about international waters, international travel, any planning? Where are we sitting with that right now?
Is this for me or Jen?
And any one of you could offer, but I think both of you have experience with that.
You want to start with it, Bill, and I'll follow?
Sure. I mean, for international programs right now, it's a little bit like states in terms of what are their requirements. Number one, we are the country with by far the most infections in the world. And a lot of countries are not going to be eager to have us come into their country for some time to come. So one is, are you allowed to go there? Number two, are there flights going there? What are the visa requirements? A lot of the study abroad organizations have shortened their semesters for the fall to try and get under the visa requirements. And what are the requirements when you get in country? Is there a mandatory quarantine? Some of the international programs that I know of, they're having their students start out in hotel rooms for 14 days where they'll work online before they join their larger group. And certainly the other issue is, you know, we want to protect our students from getting sick, but we also don't want to bring COVID into another country. So really doing a good job in making sure that we're not creating problems for somebody else. Certainly if I was going to another country, I would want to be looking at what is their ability to identify disease? What's their ability to deal with it? Are there enough beds? What's the infrastructure in terms of, do they have respirators? Do they have excellent care? And there's a couple of great websites now where you can just look at whatever your destination country is and just see, do they know how to identify disease? Do they know how to do tracking? Do they know how to chase it down? And the other part I'd be looking at certainly is, what are the trends in that country at the moment? And if you're in a country, you want to be monitoring it. If you have students in a country, you're going to be monitoring on a daily basis, because if all of a sudden they start to have a spike, you're going to need to go to plan B. Over to you, Jen.
Yeah, and also, yeah, we end up in the study abroad realm. So a lot of universities aren't even, you know, allowing study abroad for a while. But also, like Bill said, looking at some of the small islands that we go to, especially in the South Pacific, we would not want to have that burden put on a small community if something started to go awry. Also, many of the countries did what New Zealand did and said, we will not, you know, accept any vessels coming in because of what was playing out with the cruise ships. So we were lumped in with that group of just being a vessel coming in with a group of people, even though at that point it was crew only. The only way, like in French Polynesia, we could probably end up going there is if we had an emergency. But even coming into Hawaii had its limitations for a US flag vessel and all US citizens. Yeah, so trying to look at it would be great to run a program and be able to go to some of these countries, but yeah, the burden that we may be able to keep everybody healthy and stuff, but the potential of the burden that we could put on a small community would be great.
So that kind of brings up one of the questions here is that, you know, what we're talking about is the idea of having COVID on board and potentially going into a port and bringing it there. But what about other things that you might need to go into port for? Just normal everyday operations that might be an emergency, but they're not COVID related. What does, you know, how does that address? How is the port going to address that with a ship that's non-COVID, but still coming from elsewhere? Is that an emergency response in this current climate? And how is that going to impact that bubble that's placed around the ship in terms of quarantine and operations?
Yeah, certainly it's just like every state around here has limitations in their ports when vessels come in, some not able to clear customs or say their underway time doesn't count as quarantine. And then trying to keep the bubble. We, when Kramer was coming up the coast, worked hard to keep that intact with limited access to the vessel, treating it as your front door, the side of the vessel as your front door. So no one coming on board, masks or face coverings, and all that, and you know, having food delivered, and even because it's been unclear if things can be transferred on food or paper stuff, of having anything coming aboard being put in a space for a quarantine for a couple of days before it's taken below. So doing whatever measures we could to keep that bubble as close to as intact as we were able based on what we were given.
And did you allow crew to go on shore to the, were they responsible for going to the grocery store? Could they get takeout? Could they, you know, or is it everything just basically stop at the dock?
They could get things delivered. They could go out for run or walk and things, but not, you know, certainly so many things were closed, and looking at as things are opening, still working with the idea that you don't want to be in an enclosed space. So not going into the grocery store, not going into the coffee shop, but you can do curbside pickup, you can do delivery, things like that. So trying to alleviate and take that potential of being in a closed space where there's a higher percentage of transmission out of the equation as best we could.
Okay. Okay, well, that is, we're at time, past time. It's been a great presentation, and I really appreciate all of your participation, the people who attended and posed questions. I think it's really important that we ask these questions of each other and help support each other to find the answers best we can. You know, having the personal experience on the front lines, and then Bill, your experience, you know, working with such a breadth of different types of organizations, working around the world. This is important conversation. We'll come back to something that addresses day sales just a little bit more explicitly, because I think that's going to be a conversation that's going to carry on through the summer as things develop. Please look for the information online. Please look for other bulletins of other webinars that we'll be hosting, and please do participate in the other meetings that we have of the captains, the rising professional mariners, the executive directors and the administrators of these organizations. And we appreciate all the support that we're providing each other at this time. And we'll take any questions. Please send them to me directly, Chris, K-R-I-S, @tallshipsamerica.org. And we'll do the best to find answers for you wherever we can, or at least continue to ask the right questions. Thanks, Bill, Shannon, Jen, thank you so much for participating. Thank you to everyone, and be safe out there.
Bye-bye. Thanks.
Thanks, Chris.
Thank you.